Good morning, good evening, good afternoon to everyone in various time zones. And indeed, it's a pleasure today for us here at 50 Plus and Elderly Care India to invite Dimitri to have a conversation with us, about some various intriguing and very interesting facts we have been reading about, seeing around the world, especially in the elderly care sector. So, first of all, Dimitri, it would be a pleasure for me to have you and have this conversation, and Pankaj, it's wonderful always, to talk about various things, to discuss things, and to let's see where, like we were thinking about it, let's see where the journey takes us, the conversational journey. So, first of all, welcome to both of you. And Pankaj, please, I would like you to introduce yourself once again to all of us.
Okay, thank you for hosting this session, and really, we are very glad that Dimitri could come on this particular platform and share his views. As far as I am concerned, I had a corporate experience of around 10, 12 years, and then from the past 20 odd years, I've been engaged in the elderly care space or the aged care space. And right now, the objective is to create platforms and to create awareness which can filter down to the grassroots level, because India as a country, we are growing, but somehow I feel that there is a lot of knowledge sharing which is required at the rural level, which will eventually bring everyone on the same level playing field. So, and this is one of the initiatives which we have started off, and we thank 50 Plus Assist and obviously Dimitri to. We look forward for the engaging discussion.
Yeah, thank you, Pankaj. Indeed, you're right. See, the idea is to make sure that these discussions reach to the grassroots level so that there can be a change. And I know how passionate you feel about the subject. So thank you, for bringing us together. Dimitri, to you, please. If you could just introduce yourself, it would be wonderful.
Yeah, again, thank you for inviting me to participate in this meeting. And about myself, I'm a registered nurse by trade, and I'm in a business for about more than 30 years. And last 20 years, I've been in executive positions in aged care in Australia. And in all aspects of aged care, in home care and hospital and home and acute and community and disability networks. And about 4 years ago, I exited the mainstream executive career, and I started my own business with consultancy initially in healthcare technology. And because health technology is my passion, and I wanted to bring a lot more technology into Australia to help providers and our clients in aged care and community care to stay at home longer, to live better lives, and to enjoy every moment of life, regardless of the healthcare conditions, regardless of we have living with dementia or living with disability or living with any other illness, and to manage to use the technology and to use smarts of this world to make the life easier. And now it's my 100% time of my day is focused around it, and I would love to contribute more to markets around the world, because I traveled the world a lot, and I saw a lot of different ways and different care models and different government investment strategies in aged care around the world. And I think we need, as you mentioned before, we need to share our knowledge, and we need to make world better, because we are aging. I am aging. I would like to live better life, in my in the next 20, 30 years of time.
Right. That's absolutely correct. I agree with you completely, Dimitri. Honestly, one thing, but I always tell it to my team also, that one thing that is inevitable is aging. So, including all of us, we all are aging, and
Yeah.
there is no one who is spared from it. So it's wonderful that we think about this very, I think, natural part of the life. And like you said, to include technology as it is developing each day, to involve it little by little. So, what do you think about the aging care sector generally in Australia with respect to the private or the state sponsor services and facilities? What do you think about that?
Uh, Actually, traveling the world, it's natural if you read Australian socials, Australian newspapers or media, any kind of media, you will see we are very good in complaining about our system, about lack of money, about complexity, about red tape. But in real life, when I'm comparing it to other countries, and I'm not talking about developing world. I'm not talking about. I'm talking about Europe. I'm talking about US and UK and Japan. We are actually not too bad. So we're providing a lot of care and opportunities to people to either live at home longer or uh, go to aged care facilities and long-term facilities, and it's mostly funded by the government and quite generous packaging, generous funding. In comparison to other world, but again, we can do better, and we can maximize viability of the businesses in aged care, and regardless if it's everything is government funded in Australia. Yeah, so it's very little, very small market for fully private aged care providers. There's in existence. Yes, we do have a couple of them, but from perspective of providers for aged care in Australia, it's either non-for-profit or for-profit. Couple of city councils do this stuff like that, so for home care packages, but generally speaking, by default, everything paid by the government and delivered by either for-profit or non-for-profit organization with different taxation and rules for profit and non-for-profit, which I think it's not fair, because everyone is looking after our elderly, and everyone has a goal to make their life easier. It's just, I guess it's a little bit unjust to separate people, private enterprise and not non-for-profit, because we're all wanting to give our elderly the best, regardless of if we private or non-for-profit.
Okay.
That's quite true.
Over
Pankaj,
here, I
what do you
just
think?
wanted to,
Mhm.
I just wanted to check because probably the aging population or the elderly population in Australia is definitely way much lesser than our country. But what at least what we can see from the UK market and the other markets as such, it is taking a toll on the NHS. Let's say for the UK market, especially when it is state sponsored. So then, in your opinion, Dimitri, what is the fine line where the state should be sponsoring, as well as where an elderly person who has the resources, they should be funding themselves?
Yeah, I think it's fair to say that everyone should have the uh, basic package, I guess. So
Correct.
everyone getting the same level of care, regardless of the ability to pay. And then the system should have options, private options or additional services option. Then people who can afford will be able to go through the menu, tick the boxes, and okay, I would like this and this and this and that, and I can pay for that. Generally, what is I know with the new legislation supposed to come in this week, but now delayed till November. Uh, that's the idea of these kind of changes in Australian market, where whoever can afford will pay more, and introducing like co-payments in home care environment, which at the first glance looks like very harsh. So it's between 5 to going up to 80% of co-payment for services if you have a means to pay for that. But again, it's still in the making, and our industry bodies trying to convince government to rethink co-payment message stuff. And I also see I saw it on overseas in a couple of locations where people can actually start to pay insurance, like private insurance premiums, which will cover the aged care. And for example, if you pay from the age of 20, you pay about $20 a month in your insurance until you get into your 65 plus 75. You get a lot of money in your insurance in your insurance pockets, yeah, and this can be used to actually fund the better services in later stages of your life. It's not in Australia, and government is not really considering it. I had a chat with a number of private insurers, not only in healthcare, but generally as an idea we discussed, and they think it's possible to do, but it will need to be supported by government framework, and currently government not really interested in adding the private health insurance component to aged care. I think it will be easy to implement, but it also will give you a lot more opportunities in your later life to choose actually what you would like to do, where you would like to stay, and what kind of care you would like to have in your later stages of life.
Okay, that's good.
Well, I think it's amazing the power of compounding and starting early. I think that really makes a lot of sense, to be honest, when we are able to understand this from that perspective. Pankaj, what do you think? I'm sorry, I want to compare it from the Indian scenario now, the situations. What do you think? Something like this in terms of government policy should be a challenge for India, or do you think it can be implemented? What do you think about this, Pankaj? Because you have been working in policy for such a long time, I would love to know from you.
The number one, I think it is practical to have this kind of a early bird offer where you start putting in certain amount of money, but it has
Correct.
to be again being it should actually be in going into the government coffers. It cannot be private sector. Okay, so like
Hmm.
today, when you have your public provident fund, or if you have your pension funds, so a different kind of elderly care fund can be created where you people start putting in money as per the resources, and over a period of time, when the institutional level facilities come into a certain level, let's say after 5 years or 10 years, the government starts creating these market or good quality services. That's the time the senior citizen should be able to use these particular services, whether it is again home care or care home services. So definitely, I think yes, it is there. Again, the challenge what lies is India is always on a reactive mode. It is not on a proactive mode. So even if you look
Yes.
at the health insurance penetration or the life insurance penetration, that's probably the last thing we think about investing into.
Hmm.
I've been into insurance sector for a couple of months myself, and it is firstly insurance as such is seen as a kind of a very slippery product to invest in, and so probably the credibility of insurance in India has taken a hit because of the refusal of claims left, right, and
Yes.
center. But if there is a government intervention at the central level, not even at at the state level, and a central fund is created, I'm sure it is going to go a long way in terms of the benefits to the
Yeah.
senior.
I think also opens a lot of opportunities to begin with for private players, and eventually, if the government, like you said, puts a foot down, I think that will really help. I kind of agree with the perspective. And Dimitri, what do you think? What are the challenges or issues you see in the sector in the future, especially with the new AI technology and so many new things coming up, and especially you specializing in technology? What do you think about these challenges that we might be facing?
I think the major challenge in aged care sector, and I think it's in healthcare sector in general, is finding the correct staff and finding the people who can actually care. And in aging societies like Australia, Japan will be the brilliant and examples that already in below the 1 replacement rate. And Australia will be joining probably in the next couple of years, 5 to 10 years. We just physically we don't have the people, we don't have the hands. And there's a lot of competition now in the world, and people trying to steal stuff from developing countries, which don't really help. Like a lot of carers coming to Australia from Asian area, from Nepal, from Philippines, from India, from everywhere. And I guess it's unfair on countries, on India, on Philippines, because they're losing their staff and their population aging as well. And what technology can do, technology can assist us to optimize the care. We need to remove all these boring, we call it low value items, when staff spending almost half, at least registered nurses spend about 40% of their time on documentation, checklist, and all this nonsense, when we now have the technology to assist them to remove this component from all the day routine of the management of the facility and do it automatically at the background, even improving the quality of outcomes, because technology can do it a little bit better, make sense of data, which will take the person a couple of weeks to understand and do the research and the analysis of the data set. When your technology can do it in a second now, then we will improve staff availability to actually care for our elderly, because we need their hands and they need as much time as we have to improve delivery of care to our elderly. They spend more time, so 90% of 8 hours of a shift will be spent face-to-face, actually providing care, giving care, doing coordination of care, and using the actual knowledge, like a clinical people and carers, to help to improve outcomes for our elderly. And I think another opportunity for technology is to start early. I'm in my mid-50s, and if we can start prevention and primary care programs early with the help of technology, because technology can now monitor your sleep, monitor your blood pressure, automatically monitor your respiratory rate, heart rate, and recognize the patterns even before you think, before you understand that something wrong with you. And when we will be able to prevent a lot of catastrophic events, and prevention of catastrophic events equal better quality of life. So people not getting disabled by the stroke, by the heart attack, by diabetes, or by many, many, many things, and they live better life. So live better life equal not going into any aged care program, equals saving money to government, and also removing these people from circulation in acute care, in aged care market, which will help government to spend money wisely and invest in a different project. So technology is not replacing people because we just don't have people to replace. Technology is augmenting our ability to deliver something more tangible, something more personal, and improve the life of people rather than this fear of technology ChatGPT gonna replace all the doctors and nurses. You just cannot replace
Yes.
nurses.
Yeah.
Maybe in the next century, but now it's when we still need people to communicate with human beings.
I agree. I agree. I think the human touch cannot be replaced. And you gave a very valid point to replace the management part, which is actually not the caregiving part, with technology and replace those human work hours saved to actually the real work that the team actually should be doing. That sounds amazing. So, Pankaj, I'll hand over to you for the next question. So basically, now we wanted to go on a section where we want to talk about the main services that the sector is focusing upon, like the home care or residential care. What do you think is the main focus
Yes.
at this point in time? I want to know from Pankaj greatly, from Indian perspective, and then from Dimitri from the Australian market perspective, and other markets that he has been studying about. So I'd love to know about that.
So, Dimitri, I've been sort of following up, or I've been reading the the Australian standards in my limited capacity from the days I think when it was called the Accreditation Agency of Australia or something like that. From those days, I guess, and when probably you all used to use the national minimum standards as your documents. Now I think you've changed the entire. I think past couple of years you've changed the or
Yeah.
rearranged the standards as such. So I've been quite inquisitive as to what, as you spoke, quite interested into what is the impact or what is the focus area as of today. Whether is it home care or is it care homes or it is the retirement homes, which I believe are called retirement villages in Australia.
Villages, yeah, retirement villages in Australia. So the focus again, we're supposed to completely change our approach to management of aged care with the change of introduction of a new Aged Care Act 2024, which replaced on a Aged Care Act 1997, and new standards, 7 standards instead of 8, and new home care system, which is support at home. And we're also revamping our NDIS funding models and retirement villages model. So Australia is going through a lot of change now, and it's very difficult time for providers. And I think we had many discussions in the last couple of months before we knew it was delayed about how industry can cope with the change, because it was a huge change. In general question and discussion with the people was, okay, we are fighting for last 30 years with in trying to renovate, I call it, it's not revamping, it's renovate aged care standards and introduce new models of care, introduce new rules, payment systems, and we still on a place where a lot of providers are in red, not getting any profits from their operation. So, and in real life, any business with 20 years of red on P&L statement should go out of a business. And we still there. We're still trying to revamp the system, and we're ending up in exactly the same position. And from what I see and what I hear from the people in the industry, it's every single round of replacement or enhancement of the standards and the Aged Care Act and legislation start to bring a lot new red tape, a lot more complicated, a lot more compliance cost, and very, very limited outcomes. Because as a business person, I would like to understand return on investment. The simple concept of return on investment and effectiveness of a business, and it's not there. We're still there. We still a lot of our providers are in red, non-profitable at all, and it's both for profit and non-for-profit. And that's the sad environment in Australia, because I don't see how we can continue in the same pattern. And I have little hope of any major changes in Australia with introduction of a new Aged Care Act and new legislation. I floated a couple of times ideas of why don't we go just and do the ISO for aged care. We do have ISO for healthcare, 27001, 173, and it's international understandable standard. You tick the boxes, you're compliant. You don't tick boxes, you're not compliant. Because in current legislation in Australia, it's a lot of gray areas which are open to interpretation by assessor. And each assessor we're all human beings, and we interpretation of certain things, it can be different. And there's no black and white in Aged Care Act or quality standards. You can go either way. And if you're good in marketing and sales, I guess you can convince agency, convince government, so you're doing right thing, just manipulating this a little bit of loopholes in the legislation in Australia, in the gray areas. So why don't we do just normal, like in any other industry? We do ISO test, ISO compliance, and that's easy. Everyone understands it across the world. The same way of looking at things, same way of caring for people, because we're all same around the world. If the standard applies in India, in US, in UK, and Australia, the same ISO standard, I think it will be much easier to people who is travel around the world and moving from country to country to understand, because you're moving from New Zealand to Australia, it's just a neighborhood country. It's completely different HK systems. Singapore is completely different. India is completely different. So again, I'm a fan of ISO approach to all HK standards, and it will reduce cost of administering compliance and bring everyone under the same standard, under the same line, and under the same expectation.
Somehow I feel, whether it's Australia or America or UK or Canada, there is a lot of documentation time which all of you spend on.
Yeah.
It's like, I think out of 8 hours, probably 2 hours is spent on filling forms or online reports and things like that. Which I understand is important from the compliance factor and from the audit factor. But I'm just comparing the socially developed countries with our Indian system. I think somehow these kind of so much of documentation in India will never work. At least for the next 10 years, it will never work. Primarily because of two reasons: the people who are going to be filling up or monitoring these compliances, they don't have that bandwidth in terms of education. Because most of the caregivers are still at a very basic level of education. And so that probably till the time they are not able or they are able to understand it into their own language or in English, that is going to be a very long walk towards that end. And secondly, I was surprised. I've been watching this particular market of Australia and the Asian people coming in for caregiving courses and things like that. Surprisingly, Nepal in the past, I think 5 or 7 years, 6 years, the number of Nepalese the people who are coming in as caregivers is it's amazing. I think they do their certificate 2, certificate 3, certificate 4, and they get employed. Whereas vis-a-vis Indians, I'm not seeing too many Indians getting into this as compared to what Nepal has picked up recently.
Yeah.
So Any thoughts on that part? Probably
Yeah.
Mrigna can also say from the Brazilian aspect.
Yeah, so honestly, I agree to you, Pankaj, in terms of, say, every country has their own hurdles and all own difficulties, as we're talking about, no? So in India, yes, though there is not that great red taping, but I think that's a huge issue because then there are no compliance standards as well to adhere to, which in turn is a huge problem, as we are discovering little by little from the Indian perspective. Brazilian perspective, if you want to know, honestly, here, it's of India, whereas in you see a lot of private players discovering and trying to enter the market now little by little. But again, uh, the very important thing that Dimitri just now mentioned is that there has to be return on investment. And if because of the red taping that's not coming up, so private players do not have that kind of patience at times. Not everyone, I would say. A few of them, yeah, of course. I would not deny, but yes, if there's not that kind of return on investment, it becomes difficult. And from care, skill labor, or I would say the care team perspective, if you're looking at, it's the same problem now in Brazil. Brazil has a huge aging population, and the problem is do not have such huge bases. In fact, yesterday I was in conversation with a person who is very expert in palliative care. He's from Kazakhstan, he and his wife, and they both are settled here in Brazil, and they have their own palliative care unit. And he was telling me it's so difficult to find the right people. But due to now disturbances in the Middle East, a lot of population of Middle East is flocking into Brazil, but little by little they are becoming part of this caregiving tree, which is amazing for us, how the global perspectives and the situations change are affecting each sector, in the given industry. I mean, if we see that. And honestly, it's amazing for me also to realize it, that things are so dynamic and they're constantly changing. It's amazing. So Dimitri, I would have this last thing that I would like to know from you that I have been reading a lot also about, that I was curious about. So if you would like to talk about any particular case study or large impact initiative, which you think we should be aware of, which you would like to talk about, that would be the last thing I would love to know from you.
Yeah, so we again, like, if we can step back to the technology part of healthcare, you can always, I mean, we can all see all the across the socials and media, and everyone is super excited about technology in healthcare. What can technology deliver in healthcare? And we're all trying to make it life for our staff easier. For not doing stuff manually, just remotely measurement of blood pressure, heart rate, anything falls. And we're missing very little, small part of it, of all this excitement. It's understanding of how the technology actually works. And I think published a couple of articles recently about how technology affect people specifically in aged care facilities. And I use an example of wave radars, which in essence is a 5G technology between 6 to 60 or 300, depends on the frequency of a chip. And it's basically, consider it's in a simple language as a 5G antenna in your bedroom and a toilet in the aged care facility, and it's a very small environment. The technology is very volatile in terms of abilities to stabilize the signal, and it can interfere with your normal cellular coverage in your site. And it actually affects the people in the room. So it's constantly people 24/7 exposed to the radiation and the and high or low frequency depends on the chip. And we don't know yet about the effects, the full effects, but I already saw about 2 or 3 studies coming from reputable universities in US and Europe, questioning the safety of the system. And sometimes your providers can put disclaimer that's compliant with some kind of TGA or FDA standards. But the question is, what will happen, could happen in the future? It's we can open ourselves to a wave of litigation because we actually never ask permission from people to deploy the systems in their houses, on their rooms, from technological perspective. We ask them if you agree to have this radar in your room, but we never told them, and we didn't know actually about physical and health implication of this technology in their rooms. And that's very, very interesting part of technology, healthcare technology, which is supposed to help you, supposed to improve your health. It's actually not. And one of the major issues with that, it's your distributors, your providers who sell you devices actually has no idea how it works at the levels of physics. You cannot define physics. It's just impossible. So, and they don't understand and they don't ask these questions. And people who deploy it in the homes who might see the good return on investment by reduction of falls, by removing the activities of from the registered nurses not to go to the room and look and take something physically, but they never consider actually this health implication that actually may something happen to health of a person who actually lying in their bed 24/7 if they in their rooms and the toilet basically under the high frequency or low frequency radiation. So how it affects. So I'm really fascinated to find out, and I will continue to monitor the science papers on this topic because it's very interesting.
Very true. Very true. I agree.
I think with so much technology and AI and everything developing it, and we trying to adapt it as soon as possible, as if we are in a race, against time. I think we are forgetting to look at the implications that they may carry with them. And I think with long-term studies, we'll be able to maybe figure out, because it's true. I have this personal opinion that elderlies are the most frail population, and they have compromised immune system. We all know that it's the health is not the same as a young adult. And I'm sure because of that, these technologies or these radiations that we're using that are all around us these days may
Yeah.
have certainly a different impact on them versus on a younger person, in that case. And I think you're very correct. A lot of research needs to be done in this case. And I think we would love to reconnect with you, once again in the future to understand the changing scenario, the ever dynamic scenario. And, thanks, Dimitri, so much from your perspective and helping us to understand so many amazing things. Thanks a lot. And Pankaj, to you, please. What do you think about these same implications or same technological things from perspective of India? What do you think about it?
No, definitely. I think it's a global issue, and India is no different from this particular aspect. However, I think the Indian mindset is first to get the basics done into place, and then we'll think about all these issues. So
Yeah.
I think in the Indian mindset is very different. It is like right now, let's get the basics at least. Then we will talk about whether the food has got carcinogenic things or it has got non
Yeah.
the things as such. So we are not in a race to talk about the radiation levels or the electromagnetic levels. It is let people have the cell phone, or let people have the services first, or the products. Then we'll get into the thing whether this is right or not. But people are there. I have a very close friend who's a scientist who's recently published a paper which I posted on LinkedIn also. It's a 300 case
Yeah.
study references. I think it's a very good insight to start off with. But then there are not too many takers to it,
Mm,
because everything lands up with the 2 points. One is the education level, that is the acceptance level, and secondly is the price points.
mm,
So India is very sensitive to all these things. They'll first say, okay, let me just get the house first, then we'll talk about radiation levels next.
mm.
So
Yeah.
it's an interesting thing, and probably that is where we learn from Dimitri and from others as to which direction should we go in. It may not be immediate shift, but then at least you sow the seed of the learning curve, which has already been learned by others, and then probably we find our own path, whether that's to be accepted or not to be accepted on a particular thing.
Mm.
So that's I think that's is great, Dimitri. Really appreciate your support as always, and really loved interacting
Yeah,
with you and with Brigna.
thank you.
And,
So I just want to add on one final note.
you know,
Uh, from what I see, we a lot of people trying to travel around the world and find the best model in the world and best practice, but they don't really realize, but it actually don't fit in their country. We have different
Absolutely.
cultures. We have different approach. We're looking after our elderly completely different in India, in Brazil, in Australia, and then in Japan. If you find a beautiful model in Denmark and you want to try to replicate it in India, think about it. It's not gonna
Mhm.
work. So I think understanding the diversity, understanding the culture of your country, understanding not only country but also communities you serve in different countries. It's extremely important, and you don't need to rush and replicate beautiful stuff from US, which work perfectly well there under the US system and the US culture in this particular Texas in the state, but will never work in Kerala or in Australia, because it's completely different and different expectations from people and different funding models. So please, just when you building something for India, please think about Indian culture first and culture of each your state, and do it appropriately for them, and not just replicate something from around the world. Basics are important, best practice of delivery, but actual delivery of the services and structure of the services, it's super important to be the exactly cultural fit to your community you serve in your country.
no, very well said,
Very.
Dimitri, and I think that's a key takeaway from this entire discussion. End of the day, I think it filters down to being aware of the best practices, but then to create your own best practices in the environment which works for you, rather than the cut, copy, paste, or
Mm.
just bringing the same model. Thank you very much, Mrigna. I'd like to.
Yeah, thank you, everyone. Thanks a lot. And we'll soon share the recording with everyone. Have a wonderful day or night, whichever time zone you are in. Ahead. Take care. Bye bye, everyone.
Right. Thank you, Dimitri. Right. Thank you, Mrigna. God
Thank you very
bless.
much.
Okay. Bye.